25 years ago and talked to Mike about his experience then with the early portion of his dental implant experience. And we're here now to talk to him again 37 years later now, excuse me, 25 years later now, about his experience since then. Although he's had a long, very, very good relationship with Dr. Barbanel and his team for 37 years. So Mike, welcome. Appreciate you doing this again. We talked 25 years ago and you had a lot to say then. I'm hoping you have perhaps even more to say now. Tell us about your experience with Dr. Barbanel over 37 years.
Well, it's really been good. It started with, I was seeing a dentist where I worked. We were in the same building, same company that I was working for. They were working for the same company. And they discovered that my tooth, corner one, it was resorbing. That means it was getting hollow inside for no known reason. And there were two of them, and they both had no idea what to do. They referred me to Dr. Barbanel. For all I know, they were former students of Dr. Barbanel. They were fairly recent graduates from USC, and I understand that Dr. Barbanel had taught there at the USC School of Dentistry. So Dr. Barbanel nursed that tooth for about 10 years or maybe longer. And fortunately, I kept it for a long time, but when it was time to say goodbye to that tooth, he did an implant. And as I recall, I was quite pleased with the results. And I was surprised, as I recall, that I had no pain afterwards at all. I have had three major problems. The first one was the post that supports the crown. It broke. So that created a lot of visits to the doctor to have it fixed. The next problem I had was I was seeing my family dentist, and he said, "Mike, your implant is failing. You're about to lose it. You need to go to the surgeon that I'm referring to you right away because he has to take it out." Instead, I called Dr. Barbanel. He saw me right away. He fit me into his schedule, squeezed me in. He says, "Mike, well, it doesn't look too promising, but why don't we just try a long shot and try a little surgery and see if we can help it." So he did the surgery, and it lasted for several more years until, well, actually it was about 11 years since then. Doctor says, "Well, it's looking pretty good, but if you want to last the rest of your life, you probably should have that surgery again." So he did the surgery, and if all goes well, I'll live happily ever after with it.
How would you describe the experience with Dr. Barbanel and his staff if someone were to come to you and say, you know, I've got this problem, I think I might need a dental implant. Can you give me any observations of your own on your experience with Dr. Barbanel?
He is very patient-oriented, and he makes sure that his employees are also. He never talks about, I never recall him saying anything about his scholastic background, but it's quite extensive. I happen to know that he got his doctorate in dentistry from University of California. After that, he went to Harvard, got an advanced dental degree, another doctorate degree, and he got some kind of certification also from Harvard. So, and he's done all kinds of scientific studies, wrote papers. So he's state of the art. He's right there.
You sound like you have a great level of confidence in him.
Oh, I do. And you won't find any other dentist that have done as many thousands of implants as he has.
I spoke with Dr. Barbanel before talking to you. He said he's done over 15,000 implants.
Wow, I believe it. He's really a hard worker.
Mike, if there was one summary, call it, I don't know, a bottom line, about your experience with Dr. Barbanel and his team, how would you describe that? Tell us what you would say to somebody asking you that question.
You know, the bottom line is, if you have to have an implant done, he's the one to go to. But if you have a problem, that's really the place you have to go, Dr. Barbanel.
Mike, if you don't mind, can you tell us, I guess you're retired now, but what have you done for a living over the years?
I was a pharmacist.
So you actually dispensed medicine, which makes you a medical professional in some ways, I guess.
Oh, yeah.
Yeah. And so as a retired pharmacist and someone who's had, frankly, a long experience with medical diagnoses and those kinds of things, how is it that you ended up choosing Dr. Barbanel for your dental implant and for your now 37-year-long experience with him?
Well, it started off where I was referred to him by two dentists who apparently knew him, or they at least knew of him. And when I found out more about him, it turned out that he was an instructor over at University of California, no, excuse me, USC. And maybe those two dentists who recommended me to him, maybe they were his students.
Mm-hmm.
In addition to that, I know about his background. He after getting his doctorate in dentistry, he went to Harvard and got an additional doctorate.
Mike, you mentioned earlier, and you were pretty transparent, frankly, about the problems you've had with your implant over the years. Where do you think that came from? What caused those problems?
I think it's because state-of-the-art then is not the same thing as state-of-the-art now. The new implants that everyone is using now is built in such a way that the post would not break nearly as easily. With the old post, I have so much bone loss that the post was quite long, and there was quite a bit of leverage on that post, and eventually it just snapped off.
And newer processes, newer hardware, all those kinds of things, for lack of better terms, make it a far more state-of-the-art process than it was then.
Much more stable.
Yeah. You have talked to us about the history that you know about Dr. Barbanel's background, the fact that he's a Harvard graduate, the fact that he was a USC staff member and who trained students at USC. You know more about his background than probably he's willing to talk about himself. A lot of that has to do with the fact that you yourself are a retired pharmacist. Tell me about how important it is that those kinds of medical qualifications went into your decision to choose Dr. Barbanel.
Well, just like choosing a plumber, you like word of mouth. And in this case, I got word of mouth from two people who I knew from where I worked. And so, you know, these were dentists who knew of him, and that was a great recommendation. And then I also looked up his background. And plus, there weren't that many people doing implants at that time. I mean, implants had been around for, you know, a number of years, but it's nothing like now. He was really a specialist.
As a medical sciences professional, obviously you're in the know, you do reading. Dr. Barbanel has actually told me that you have a special relationship with him because you've actually shared a number of articles with him. You send those to him for his own reading and his own research and those kinds of things. And he, Mike, actually credits you and your involvement in your treatment plan with the success that you've had.
Well, it took a lot of determination, but every bit of it was worth it. He used to have me using a syringe and putting a tetracycline mixture up into the tooth area. And I did that daily for years. And, you know, it was a chore, but it was worth it.
Yeah, it obviously was, because you look great. You got a lot of confidence in your dental implant, and you seem pleased.
Well, thank you.
Yeah, that's great. Thanks for joining us.
Glad to be here.